tired of weak stream, late-night bathroom runs, and feeling like your bladder's never empty? Before you reach for another pill, let's talk about what actually works and what's just a waste of money. Supplements are everywhere these days. And as men age, especially beyond 60, it is not unusual to see guys taking 4 or more different dietary supplements daily. But the big question is, can any of them actually help with your prostate health? Hi, I'm Dr. Max, a urologist and men's health expert. Today, we're diving deep into a question I hear from patients all the time. Men want to know if there are any natural supplements that actually help with an enlarged prostate, or with those frustrating urinary issues that often come along for the ride. Let's break down what the science says, what might help, and what's probably just hype. We are talking about benign prostatic hyperplasia, also known as an enlarged prostate. It is extremely common. In fact, by the time men reach 80, about 80% of them will have it. And even before that, millions of men struggle with symptoms, slow urine stream, hesitating to start, feeling like your bladder never fully empties, or getting up multiple times at night to pee. Some guys even feel the urge and cannot make it in time. So wouldn't it be great if there was a natural way to ease those symptoms without jumping straight to medications or surgery? Before we go any further, let's define what we mean by supplements. These are phytotherapeutic products, which just means they come from plants. But not all supplements are created equal. Plant compounds vary naturally, and different companies use different methods to extract and process the active ingredients. This means even 2 bottles of the same product from the same brand can vary in how well they work. A good example of this is saw palmetto. In one study of 27 different saw palmetto products, the active compound, the free fatty acids, ranged from 0 to 95%. Only 17 products actually met the standard level of at least 85%. That kind of inconsistency makes it tough to know what you're really getting. So let's walk through the major supplements people take for prostate health, starting with saw palmetto, also known as Serenoa repens. It is one of the most heavily researched supplements in all of urology. It comes from a type of berry and is believed to reduce inflammation, block the enzyme that converts testosterone into dihydrotestosterone, and possibly reduce the binding of that hormone in the prostate. It sounds promising, right? That is why it exploded in popularity in the 1990s, especially in Europe and the United States. Early studies showed positive results, and many men preferred trying a supplement over taking prescription medications. But then came the gold standard studies. The New England Journal of Medicine published a large, double-blind, randomized controlled trial with 225 men who had moderate to severe symptoms. They took saw palmetto at a dose of 160 milligrams twice a day for an entire year. The study measured everything: symptom scores, urine flow rate, bladder emptying, and even quality of life. And the result? No difference between the saw palmetto group and the placebo group. Then in 2011, a follow-up study in the Journal of the American Medical Association looked at over 300 men across 11 centers in North America. This time, they tested higher doses, up to triple the standard, and still found no significant benefit. At that point, researchers combined all the available data into what is called a Cochrane review, a comprehensive analysis of the best studies we have. That included 17 trials and more than 2,000 men. When they focused only on the high-quality, long-duration studies, they found the same thing: no clear benefit in symptom relief or flow rate from saw palmetto compared to a placebo. Now, does that mean saw palmetto is useless? Not necessarily. Some men still report feeling better. I tell my patients, the science does not support it as a guaranteed fix, but if it is working for you, and it is safe, I am not going to take it away from you. Next up is Pygeum africanum. This comes from the bark of the African cherry tree and has been shown to have anti-inflammatory and hormone-modulating effects. The most thorough review, also by Cochrane, included 18 randomized trials and over 1,500 men. The duration was short, about 64 days, but the findings were encouraging. Men who took Pygeum had fewer nighttime bathroom trips, less urine left in the bladder after urinating, and slightly better urine flow. That said, there have not been many long-term follow-up studies. It is often combined with saw palmetto in multi-ingredient supplements, and some people feel they work better together. But again, more research is needed. Let's talk about pumpkin seed extract, also known by its Latin name Cucurbita pepo. This is another popular supplement. It works on the same enzyme as saw palmetto and has strong anti-inflammatory effects. In animal studies, it has been shown to increase nitric oxide, which helps relax muscles, potentially easing symptoms. Pumpkin seeds are also high in zinc, which the prostate needs in large amounts. In one clinical trial, nearly 500 men took either a pumpkin seed extract or a placebo for 12 months. The group taking pumpkin seed had a 65% improvement in symptoms, compared to 54% in the placebo group. That's a big placebo effect. But even so, there was some added benefit. Another large study with over 1,400 men confirmed those results. Still, it is not clear if the improvements were enough to make a real difference in daily life. Now a quick warning. Pumpkin seed extract is high in magnesium, phosphorus, and zinc. If you are already taking supplements for those minerals, or if you have kidney problems, check the label and talk to your doctor first. Another supplement worth discussing is beta-sitosterol. This is a naturally occurring plant sterol, structurally similar to cholesterol, and it's found in a wide variety of foods like fruits, vegetables, seeds, and nuts, especially in high amounts in things like avocados, pecans, and pumpkin seeds. In the context of prostate health, beta-sitosterol appears to work on several levels. First, it has potent anti-inflammatory effects, which is important because chronic inflammation plays a big role in prostate enlargement and the resulting urinary symptoms. It also has what researchers call pro-apoptotic activity. That means it can encourage older or excess prostate cells to die off naturally, which may help slow down the growth of the gland. The most rigorous review of beta-sitosterol's effectiveness comes from a Cochrane analysis published back in 1999. It pooled data from 5 randomized controlled trials involving more than 500 men with moderate to severe lower urinary tract symptoms related to benign prostate enlargement. The results showed that beta-sitosterol improved both symptom scores and urinary flow rates compared to placebo. That means men who took it were peeing with a stronger stream and reporting less urgency, frequency, and nighttime urination. However, it's important to highlight that these benefits came without any reduction in prostate size. So while beta-sitosterol seems to help with how the prostate behaves, it doesn't physically shrink the gland. Side effects? Mostly mild, some bloating, gas, or changes in digestion. Let's also cover stinging nettle. That's the plant with little hairs that sting your skin. When taken as a supplement, particularly the root extract, it may reduce inflammation and block certain growth pathways in the prostate. One study looked at stinging nettle combined with saw palmetto, given over nearly 2 years. The results showed improved symptoms and flow rate. But stinging nettle is not for everyone. It can interfere with iron absorption, interact with blood thinners and lithium, and lower blood sugar. It can also reduce potassium levels if you are taking certain diuretics. So definitely talk to your doctor if you are considering it and take other medications. Last but not least is lycopene. This is a compound found in tomatoes, watermelon, and pink grapefruit. It has antioxidant and anti-inflammatory effects and might slow down prostate cell growth. The research on lycopene is not as solid. Most of it comes from observational studies or mixed supplement trials. Dosages range wildly from 10 milligrams to 500 milligrams a day. If you want to try lycopene, start with food sources like tomato paste. But be aware, tomato-based foods can irritate the bladder in some men. And lycopene may affect blood clotting, so stop it before surgery. So, what is the bottom line? Saw palmetto is the most well-studied supplement for prostate health, but in rigorous trials, it has not shown a clear benefit. The others, Pygeum, pumpkin seed, beta-sitosterol, stinging nettle, and lycopene, have some encouraging data, but the research is still evolving. If these supplements help your symptoms and you tolerate them well, great. Just be honest about your expectations. And do not rely on supplements alone if your symptoms are worsening. Because an enlarged prostate can slowly wear down your bladder over time, and once that muscle is weak, it might not bounce back. At the end of the day, Our goal is your quality of life. Whether it is a supplement, medication, or a minimally invasive procedure, we want you feeling better, sleeping better, and living the life you deserve. If you found this helpful, be sure to subscribe and consider becoming a premium member. Every month, we do exclusive Ask Me Anything episodes and offer early, ad-free access to all of our content. You can check it out at renamalik.supercast.com. Thanks for watching and take care of your health. You are worth it.